This is Radio Health Journal. I'm Nancy Benson. This week, things to consider when it comes to pet food.
Obesity affects up to 2/3 of dogs and cats that present to their veterinarian. So it is the most common nutritional disorder that veterinarians are faced with on a daily basis.
Should your dog or cat go vegan or gluten-free? When Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
It was a dreadful disease, a hemorrhagic fever that killed quite gruesomely.
The illnesses workers faced while building the Panama Canal. Then,
there's a lot of things that we can learn in this country that are different overseas.
The importance of keeping a global perspective on learning. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
For the last 40 years or so, Americans have heard nonstop that we eat too much and exercise too little, with the result that 2/3 of us are overweight or obese. It turns out that our pets have the same problem.
Obesity affects up to 2/3 of dogs and cats that present to their veterinarian. So it is the most common nutritional disorder that veterinarians are faced with on a daily basis.
That's Dr. Valerie Parker, Associate Professor of Veterinary Clinical Sciences at The Ohio State University Veterinary Medical Center. She's a specialist in small animal internal medicine and nutrition.
Most of the time, people are feeding good quality commercial pet foods, and a lot of pet foods are formulated to be calorically dense, and they're also very palatable. So it doesn't take a lot of volume to get a lot of pets fairly overweight pretty quickly. Most people have absolutely no idea how many calories a day their pets are eating. So the first and foremost problem is excessive caloric intake. And to a much lesser extent, although people want more emphasis to be placed on exercise, to a much lesser extent does exercise or caloric expenditure influence most of our pets.
Parker says dogs and cats are members of the Clean Plate Club. If food is in front of them, they'll eat it, even if they've already had their fill. So it's up to us to measure out the right amount of food for them.
Most commercial pet foods are so palatable that they will keep eating. It's just like people, right? Like if you put a bowl of any good food, I was going to say ice cream because that's like one of my favorites, but I will keep eating it until my belly hurts if I'm not thinking, And so dogs and cats can't apply any logic to their intake. They're not going to think, oh, I'd better not eat 500 extra calories a day today. It really is up to pet owners to determine what is an appropriate amount to feed. And because most pet owners really don't know, that's a good conversation to have with your veterinarian, is what is an appropriate amount of calories to feed. And most pet food bags are going to overestimate a pet's needs.
One way to counteract that is to ask your vet what your pet's resting metabolic rate is and use that to measure out food. Commercial pet foods are fine, Parker says. In fact, she says that people who make their own pet food to control the ingredients are usually making a big mistake. Most homemade recipes don't provide a balanced diet without lots of input from a veterinary nutritionist, so stick to the commercial brands.
I think they're mostly okay. I feed my pets commercial pet foods and always have, probably always will. It comes down to finding a company that is well-known and reputable, that you're comfortable with. It comes down to considering the individual animal and what its nutritional needs are, and finding options that will work for you and the pet.
However, one thing not to do is to assume that if a food fat is good for you, it must be good for your dog or cat too. For example, going vegan.
Vegan diets can absolutely be harmful for certain dogs and cats. Dogs and cats were not designed to be vegan. There are certain nutrients that are much harder to come by eating vegan diets, and multiple studies have investigated commercial, both vegetarian and vegan diets, and found that there are significant amino acid deficiencies and nutrient deficiencies that can occur. It gets even more complicated if you're trying to do a home-prepared vegan or vegetarian diet, because probably one of the most severe adverse consequences that can result is the formation of dietary-associated dilated cardiomyopathy, so a certain heart disease that dogs can get eating vegan or vegetarian diets if they're not getting the proper amount of amino acids in their diet, or if they're eating certain other ingredients that are affecting the bioavailability of those amino acids.
And yes, Parker says she's seen plenty of people making their dog or cat go vegan. Other owners have had their pets go gluten-free, even though Irish setters are the only dogs ever connected to gluten intolerance. One other popular trend is to feed dogs a so-called barf diet, bones and raw food. Parker says there's danger in that too, to both you and your dog.
My biggest concern is usually with the home-prepared raw diets, because many studies have shown that most home-prepared diets that dogs and cats are eating do not provide complete and balanced nutrition. So my biggest concern is for nutritional inadequacy. And then beyond that, I do worry, especially in some animals more than others, and also for their owners, I do worry about the risk for infectious disease transmission. Most commonly we think about salmonella, but it can be other bacterial organisms, it can be protozoal organisms, and so the animal eating the raw diet doesn't even have to show clinical signs to be affected and to be shedding salmonella that another animal or person may come into contact with that animal's feces and become infected.
Parker says the bottom line on feeding your dog or cat is to know what your pet's nutritional goals are and follow them.
Every dog or cat should mostly be fed a complete and balanced diet. Every dog and cat should be fed to achieve and maintain its optimal body weight and body condition score. And then if an individual animal has any certain disease process, then that animal may need specific other nutritional modifications that should prompt a discussion with a veterinarian. But the most important thing is feed a complete and balanced diet from a reputable company and feed to achieve and maintain optimal body condition.
Parker says people want to do what's best for their pets, but that doesn't mean applying human standards to their diets. She says a talk with your veterinarian is always a good idea if you have questions. Or you can find a nutrition toolkit from the World Small Animal Veterinary Association at wsava.org/nutrition-toolkit. You can also find that link on our website, radiohealthjournal.org. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
Holiday celebrations are often joyous occasions, but they can be challenging for the millions of people living with Alzheimer's disease and those who care for them. The hustle and bustle of the holidays can be stressful for those with Alzheimer's, and changes in the daily routine, large gatherings, and noisy environments can create extra anxiety. Monica Marino, Senior Director of Care and Support at the Alzheimer's Association, has some tips to make the holidays enjoyable.
First, plan ahead. Prepare the host for special needs, such as a quiet room for the person to rest. If you're hosting, let guests know what to expect before they arrive. Since crosstalk and multiple conversations can be challenging for people living with Alzheimer's, try engaging the person one-on-one or in smaller groups and keep them involved in the celebrations.
Marino also suggests experimenting with new traditions. For example, if evening confusion and agitation are a problem, turn your holiday dinner into a holiday lunch or brunch. Find out more tips at alz.org.
According to the American Cancer Society, prostate cancer is one of the leading causes of cancer deaths in American men. That's why, for men with prostate cancer at risk of progressing, monitoring for signs of progression is critical.
I'm Dr. Chris Pazanka, a urologist at Associated Medical Professionals in New York who has been paid by Janssen Biotech as a spokesperson. Men with prostate cancer, whose disease progresses after treatments like surgery or radiation, may receive hormone treatment to lower testosterone called androgen deprivation therapy, or ADT. However, for certain men, prostate cancer can further progress despite this treatment. Prostate cancer that has not spread to other parts of the body and no longer responds to a medical or surgical treatment that lowers testosterone, or ADT, is called non-metastatic castration-resistant prostate cancer, or NMCRPC. Men with NMCRPC are at risk for the disease spreading to other parts of the body. Erleada, also known as apalutamide, is a prescription medicine used to treat prostate cancer that has not spread to other parts of the body and no longer responds to a medical or surgical treatment that lowers testosterone.
In a clinical study, the median time men on Erleada lived without their prostate cancer spreading was 40.5 months versus 16.2 months. Erleada is not for use in women. Use birth control during and for 3 months after treatment with Erleada because it can cause harm or death to an unborn baby. Erleada may cause serious side effects, including heart disease, falls and fractures, and possible risk of seizure. Call your doctor right away if you experience chest pains, sudden loss of consciousness, or a seizure, and go to the nearest emergency room if you get chest pain or discomfort. The most common side effects were fatigue, joint pain, rash, decreased appetite, weight loss, high blood pressure, hot flash, and diarrhea. Tell your doctor if you get a rash. These are not all the possible side effects. Tell your doctor about your medical history of heart disease, seizures, stroke, brain injury, or tumor, and all your medical conditions. If you're concerned about your prostate cancer spreading, ask your doctor about Erleada. For more information, please see our ad in Popular Mechanics. Call 1-877-546-3586 or visit www.erleada.com.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
Child bullies grow up into adult bullies, and particularly if it's effective for them. If a bully is successful in getting what he or she wants, then they'll persist into adulthood.
What makes a nasty neighbor, a conniving coworker, or a sexual harasser?
Then becoming a first-time father in your 40s or 50s. What it's like being an old dad to young kids.
I often get mistaken when I'm with my kids at a supermarket as their grandfather. They'll say it explicitly. How are your grandkids today?
All that and more on Radio Health Journal.